Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Sarah Repking, nurse practitioner with Rush University Medical Center and an associate editor with CLD. I'm here with Dr. Schmidt, who is a third-year internal medicine resident at the Icahn School of Medicine in Mount Sinai in New York, and the author of Hepatitis C in Pregnancy. Dr. Schmidt, thank you so much for joining us today.
Thank you so much for having me.
So the first question we have is, why do you think this article is important?
Yeah, our article, we aim to kind of provide an overview of the epidemiology as well as the management of hepatitis C virus in pregnancy. This is important because over the past few decades, we've seen an increase in the prevalence of hepatitis C virus in women of childbearing age and therefore pregnancy. So we want to highlight the importance of the current guidelines, which recommend universal screening of hepatitis C virus in pregnancy, as well as following up with ensuring that these women, as well as infants born to hepatitis C virus positive mothers, are connected with appropriate specialty care, both during pregnancy as well as after pregnancy. We also highlight that even though currently there's no FDA approved treatments for hepatitis C virus in pregnancy, that may change in the near future, which I can talk about in a little bit. And pregnancy or the antepartum period could be a really great time to offer treatment to women, as typically women are getting frequent and regular healthcare appointments during this time, which otherwise for a lot of women is difficult to access outside of pregnancy.
And what's new compared to prior publications we've had?
In our paper, we highlight and review the current literature as well as ongoing clinical trials in humans of treatments, particularly the direct-acting antiviral treatments for hepatitis C that are ongoing for pregnant women. And so though there's just kind of initial preliminary trials right now that are pretty small, the results that have been published and that we've seen have been promising in terms of using the direct-acting antivirals for treatment of hepatitis C virus in pregnancy, both in terms of the safety of the drug as well as the efficacy with regards to achieving sustained virological response at 12 weeks, as well as preventing the maternal to child transmission of hepatitis C virus.
So do you have a few takeaway points for the clinician who are seeing these patients in practice regularly?
Yeah, mostly just highlighting and emphasizing that there is an increased prevalence of hepatitis C virus in pregnancy and in women of childbearing age, which is in part due to the opioid epidemic, and therefore the importance of making sure that providers are universally screening for hepatitis C virus in pregnancy and linking these patients to appropriate specialty care during pregnancy, there have been some reports of adverse maternal outcomes, as well as neonatal risks, such as most notably the maternal to child transmission of the disease, as well as with these initial preliminary studies, there's hope that the direct-acting antivirals will be available for treatment of hepatitis C during pregnancy, as they've initially been shown to be have good efficacy and safety. And right now, the current AASLD guidelines are recommending consideration of treatment with direct-acting antivirals in pregnancy, though not FDA approved, on an individual basis, and encouraging providers to have risk-benefit, evidence-based, shared decision-making conversations with the patients. And so we also highlight that as well.
Wonderful. Dr. Schmidt, thank you so much. I think this topic is so relevant, like you stated, that we're seeing an uptick in this younger population with Hep C. And as providers, we see these patients in our clinic and sometimes we don't know what to do. So I think this article is really relevant and will be helpful to, the practicing clinicians and general hepatology practices and primary care practices and OB practices.
Yes, definitely. And definitely should hopefully get some more larger studies done on the direct acting antivirals because they're seem promising for treatment.
Absolutely. Thank you again for joining us for another installment in the Clinical Liver Disease video series. And thank you to our listeners for joining us. On behalf of all of us at the CLD team, I hope you found this interview helpful. For more information about the prevalence of hepatitis C in pregnancy, and please visit us at www.cldlearning.com. And thank you again for watching.